Well, welcome everyone. I'm pleased to be here. This is the first time I've been in this building. It's beautiful. I've been on Franklin Avenue, always wondering what was here, so that's good. I actually don't work far from here. The state office for NAMI Minnesota is located at University near Cleveland Avenue in St. Paul. And we are a statewide organization. We cover all areas of Minnesota. We also have affiliate chapters, and so we have a Ramsey NAMI, we have a Hennepin County NAMI, we have an Anoka County NAMI, and then in greater Minnesota we have clusters of counties that make up an affiliate. So we really do provide three things: education, support, and advocacy for people that live with mental illness and their families, and we also help professionals with mental health resources. So we're thrilled to have a chance to talk with you today because we know you do a lot of outreach in the community, and we want to be sure that you know about resources that you can use yourself for mental health education, but also that you can give as resources to people that are struggling maybe with symptoms or maybe live with an illness but need some additional help, and then also for folks that you work with that are in your own family. And so we find because 1 in 4 adults live with a mental illness, that's 25% of our adult population, it's really everyone knows someone that lives with a mental illness. And nobody gets better without the support of family, friends, coworkers, and things like that. So even if your work did not directly be with people that are managing symptoms and living with a mental illness, I think from a family standpoint you'd probably also benefit. So this program is called Get to Know NAMI. We actually offer this once a month at our NAMI offices. So if you have other folks that would like to hear about our resources, they can come once a month to our NAMI offices. And I've put some things up on our whiteboard here so that you have them as resources. You have a sheet in front of you. It's black and white that has a picture of some irises on the top. This has our website on it, but our website is namihelps.org. And if you don't remember that, you can just put in NAMI Minnesota. But be sure you put Minnesota someplace, because if you just put nami.org into a search browser, you'll get our national website. Nothing wrong with that, but our national office doesn't list all the Minnesota classes and Minnesota support groups and things like that. So namihelps.org is the state of Minnesota website, or you can just put in NAMI Minnesota into a search. So I've worked for NAMI for 6 years, and our executive director, I gave you her name, it's Sue Abder-Holden. Sue has been with NAMI almost 14 years. And I told you we do education and support and advocacy. So I'm just going to briefly tell you a little bit about the organization, and then Maureen, my guest, and I will really be talking about resources that kind of fall into those education, support, and advocacy parts of our mission. And Maureen will also share a personal story with you. So Sue Abder-Holden's our executive director. I'm a community educator for NAMI, and also I work with older adults programming. And I put Kate Hersey's name up because we have lots of volunteer opportunities at NAMI. And they're high-level volunteer opportunities, there's one-day volunteer opportunities, or there are longer volunteer opportunities. Now, NAMI is located in St. Paul, and our budget's about $1.7 million. We have a staff of about 30 people. Half of those people are part-time, half of those people are full-time. I work full-time for NAMI. And 99.9%, I think that's just one person, 99.9% of folks either live with a mental illness that work for NAMI or are family members. And you heard from Eugenia that I'm a family member. So we actually get our money to do our work from individual donors primarily. We also get some money from Department of Human Services. Most of our classes are free, and so it's very nice that the Department of Human Services gives us some money for funding some education classes statewide. And I'll tell you about a few of those. We also get some grant money, but as you know, grants are really to start up programs, and then you really have to find funding after that to kind of continue your programming. And we have a wide variety of programming. I wish I could spend time telling you about every program, but we have so many that I can't even do it in an hour. So I'm going to give you highlights. So I'd like to tell you that I think what's important in life for people, one of my colleagues, her name is Shelley White, she once said this. She thinks that everybody in life really wants a date, a job, and housing. Wouldn't you say that kind of sums it up for all of us? Now, I broadly define date. Date means friends. Date means family connections. Date means maybe a romantic relationship. But basically, we want human connection with people. And then housing, if you ever took psychology in high school or in college, there's that Maslow hierarchy of needs. You really have to take care of housing and food before you can get into self-actualization. I'm going to be very, very old by the time I get to self-actualization, I have a feeling. So housing's really important. And then the other part is just having a job. Wouldn't you concur? Most people want paid work, maybe part-time. People are also, are fine with volunteer work, but most people want to work. Our society, U.S. culture is really all about, these milestones. At 18 you graduate high school. At 22 or 20 you graduate from maybe a post-secondary program of some sort. And then after that, you have maybe your first big romantic relationship. And then maybe if you're going to have kids, you have your children. So we have kind of this prescribed path that we follow. But mental illness is really a young person's illness. And I'm going to give you a statistic that you maybe haven't heard before. And that statistic is that by age 14, 50% of people who are going to have signs and symptoms of mental illness have them by age 14. That's shocking, isn't it? It's a young person's onset. By age 24, 75% of people who are going to have signs and symptoms sometime in their lifetime have them by age 24. That means you certainly can have first signs and symptoms older, but usually you've perhaps had an episode earlier. Now, what do you think the most common mental illness is? Just speculate what you think the most, of the ones you know. What's the most common of the mental illnesses? Depression's number 2. Anxiety disorders. Anxiety disorders are 3 times more common than depression. Now, we often talk about depression because if it was winter and we had just come off 5 days of no sunlight, we might use the word, I am so depressed. If the sun does not come out, I am moving permanently to Mexico, right? In actuality, depression in the terminology of saying I'm depressed because there's no sunlight, that's not major depression. And when you lose, a grandparent or you lose a parent, you're going to be sad. Grief is normal. That's normal. That's not major depression either. And so just know that depression, we kind of talk about it just as a term that's another term maybe for being blue or being sad or things like that. But major depression is a diagnosable illness. Now, anxiety disorders are 3 times more common, and I'm not going to spend the day telling you about illnesses. That's not my purpose today, but I just want you to know some basics. So there's a big umbrella of anxiety disorders, and under anxiety disorders are quite a few things in that tent. Obsessive compulsive disorder is an anxiety disorder. PTSD, do you know what that stands for? Post-traumatic stress disorder. That's an anxiety disorder. Generalized anxiety disorder is an anxiety disorder. Phobias are an anxiety disorder. So there's quite a few things that are under that larger tent of anxiety disorders. Now, remember I told you that 50% of people who have signs and symptoms have them by age 14? That figure is particularly young because anxiety disorders have an average peak at 11. So the anxiety disorders kind of bring that figure down because anxiety disorders are really young. The average is is about 11 years for someone to develop signs and symptoms of anxiety disorder. So, that's good to know. So obviously, like all illnesses, we want to do early intervention. We want to have early intervention for cancer. We want to have early intervention for heart disease. We want to have early intervention for diabetes. Well, the same is true for mental illnesses. People do better when they get help earlier. Now, how long would you say, how many years on average does it take for someone to get help for their signs and symptoms of mental illness? On that bell-shaped curve, what's the top of the curve? How many years? 10. It is 10. You're a good group. Most people think it's much, like 3 years or 4 years. It's 10. And a lot of havoc can happen by 10 years. Lots of family relationships can be at odds. You can lose lots of jobs by that time. You can lose partnerships that you have, friendships that you have. You can lose all the money that you have. You can get involved in other mental illnesses like substance use disorder. And so a lot of havoc can happen by that time. So it's really important for people to get help. How old do you think you are when your brain is fully formed? That it's completely done growing. I'm not saying you can't learn after this age, but physically your brain is done forming. How old do you suppose you are when that happens? 25 or 26, about that age range. So can you imagine if you start using substances when you're young, like 13, 14, you start using alcohol, you start using marijuana or cocaine or methamphetamines or heroin, that means that your brain is growing with that chemical in your system. So the pleasure centers of your brain are actually growing with that chemical in your brain. So it actually causes a very different brain than if you don't use, I'm not saying I look like I'm a goody two-shoes, don't I? But it's important that kids know that. And how many of you, you all look younger than I do? Everybody looks younger than I do now. So you all look younger. How many of you in health class in high school, like 10th grade, 11th grade, how many of you had really robust mental health training in health class? Some of you look like you're in your 20s to me. It's shocking. I ask the question almost every time I speak because maybe you had a DARE officer come in, a police officer that talked a little bit about alcohol or something like that, but most people don't get very much mental health training. The way you get your training is you learn on the job. And I told you I was a family member, so I was born to a mother that already lived with mental illness. So I learned because I had to help my mother, as I was a 5-year-old, or as I was a 6-year-old, or as I was a 7-year-old. So I wish there was more education available when I was younger, but there is more education now. So part of my purpose today is to tell you about some of the education opportunities that are out there for your own families, as well as to people that you serve, that you can give them resources so they can learn more about it. So that's kind of an overview. You can certainly ask questions. Maureen and I are fine if you ask questions throughout. Don't wait till the end. And we are being taped only so that it can be on your website, because I think some people, may not be able to come today, and that way they can watch it. But I'd like to introduce my colleague, Maureen Edstrom, and she's a volunteer for NAMI, and she'll actually tell you about volunteering a little bit too, because I think it's been pretty rewarding. I know it's rewarding for me to have her as my volunteer, but Maureen's going to tell you a little bit of a story about herself. So we're just going to switch microphones, so hang with us.
Thank you, excuse me. Okay, good afternoon. It is such a pleasure to see so many people here. I have to say, one thing I'm really surprised about is that the back row is full. People love the back row, and we have one who took the challenge and joined us in the front here. I do want to say that it is a pleasure to be here. I have been doing volunteer work for NAMI for a few years, but I have been in recovery from bipolar disorder for 25 years. It was a long time ago, and I have been through a lot of different things. And even though I didn't use all the resources that NAMI has to offer when I was going through my trouble, and my family was with me, of course, but I figured on later on in the years that it was a great way to find out what they do and to give back and to volunteer for NAMI. And one thing that I want to say is that I am originally from South Dakota. Anybody been to the Black Hills? Yeah, okay, good spot. But I was raised in a very small rural community, farming community of about 1,000 people out in the middle of South Dakota. So I wasn't really kind of subjected to or learned about or was exposed to much diversity. We were white, and we were white, and we were farmers, and that was fine. But I really have to say, I've lived in the Twin Cities now for 35 years. I moved up here in 1980, and it has just been such a pleasure to experience the diversity and learn a lot. And it has been one of the best things, especially in the work that I do now, working in mental health. And of course, we have a lot of different programs and a lot of training about diversity. So although I cherish my South Dakota roots, I love the Twin Cities and what they have to offer. As I mentioned, I was diagnosed 25 years ago. Actually, it was interesting because we have a young adult program where I work now in mental health. And so I know that mental illness from the young people, age 11, and the younger adults that I work with, that I realized being diagnosed at the age of 40, people go, oh, you were quite a bit older when you were diagnosed. And I didn't realize that at the time. I just had to deal with how to feel better. But I do know now that one of the things about being diagnosed at 40 is that I had pretty much established my life by that time. There's no history of mental illness that my parents could find when they found out I was in the hospital. And everyone was absolutely in shock because I had this just normal life. And I was divorced, I was a single mom, I had a 16-year-old daughter, but I was paying a mortgage on a home. I was raising my daughter. I was working full time. I had a car to drive. And then everything fell apart. And unfortunately, I believe that mine was due to some of the environmental triggers that they talk about. I ended a 7-year relationship and went into a 2-year downward spiral because I thought, there's no way I can ever survive without him, okay? That was a big mistake. I understand that now, but it really took me down a path that I never expected. And all of a sudden, one day, I checked myself into a mental hospital. And I went into, the psychosis and having psychotic episodes. And I didn't know my family or my daughter. My parents came up from South Dakota to help take care, and they visited me for about 6 weeks, and I didn't know who they were when I was in the hospital. So they wondered if I would ever have a life again. I mean, this was really, really hard for them. Well, fortunately, the day I went home from the hospital, everybody cheered, and said, whoa, Maureen's all better. Let's take her home and get on with our lives. Well, that wasn't exactly true, but I did go home. Unfortunately, I would be in and out of the hospital again for 5 different times. So during a 2-year, really hard struggle, my family was there for me. My friends, some of them, not so much with others. They didn't know what to say or what to do, and I understand that. Talking about mental illness or visiting with someone who has a mental illness can be very difficult, and I understand that. But my mom, who was my primary caregiver, she was the most interested in figuring out what the heck was going on with me and in my mind, and talking to the psychiatrist. My daughter said one time years later, she said, Grandma was the one that wanted all the answers. She kept wanting to know. She kept asking the questions. She wanted to learn. She wanted to figure it out because she knew that would be the best way for her to be of support for me. My dad, he was there. He tried, but not nearly as invested in really learning about mental illness, as my mom was. So as I went on, I gradually, I had ECT treatments and then kind of turned the corner, but all the medication and all the stuff, all the psychosis, not remembering much of what was going on, being kind of irritable. I find it interesting now when I talk to so many of my clients in mental health and they say they have irritability. And I'm like, yeah, okay, but I think I got over my irritability a little bit. I kind of moved on from that. Fortunately, they found medication that worked, and everything started to come together, and my psychiatrist said, you're my success story. As time went down the road, when I went in to see him every 3 months, he didn't say, I don't know if you should be working. I don't know if you should be doing too much outside the home. You don't want to have a relapse, so you need to take it easy. Instead, which I'm hearing that some psychiatrists say that to people, and I understand. That is part of being a doctor and supporting your patients. I was fortunate to have a psychiatrist that said, you're my success story. Just go and do it. Do whatever you need to do because I think you can handle it. And I did. Like I say now, I had a home to go home to. I had a car to drive. And I had a place where my job, they held my job for me for almost 2 years. They had a temporary come in. And so now that was very fortunate for me. And not everybody that's recovering from mental illness and moving forward in recovery may not have all those advantages. Well, I did, and it did help me a lot. But once I was on the road to recovery, I was like, okay, I want to get my life back. I'm done with this. No more hospital. Yes, I need to take medication. I understand that, and I will be med compliant, as we use all those terms now. I'm med compliant for 25 years, and here I stand. So I know that I did everything I exercised, I took care of myself. I did have, bipolar. I told a friend of mine one time, I said, my bipolar wasn't like mania, depression, mania, depression. That's not how my bipolar. Mine was sort of this wave, but it never took me way down in the depths back in the hospital, and it never took me to, well, whatever mania can be, which is just about anything. So mine was kind of that wave. So when you ride the wave, you do have some tough times and everything. But since, in the 25 years since my diagnosis, I have worked full-time. And I did work full-time many years in the corporate world. I have now been in the nonprofit world for 5 years. I work at a mental health center. It's called Shiraka, CSP. It's a community support program. There are different community support programs around the Twin Cities. And I am a peer support specialist. I found it interesting when I was job searching that I could find a job that said, you need to be in strong recovery from mental illness. Oh, well, I guess that fits me. Okay, so I got this job as a peer support specialist. It's been 5 years now, and I do enjoy it, but I've also branched out to do not only working there, but volunteer work and working with NAMI and doing different things. But one of the things I want to say is that when I started, like I said, I wanted to get my life back, I made that choice to be a strong person again. I had no influence in my family or my friends or my doctors, my therapist, my psychiatrist. I had nobody that ever influenced me to say, oh, look out, you gotta take it easy. You don't want that depression. You really need to watch everything that you do. I had people that said, Maureen, you're a strong person. Just go for it. You can do it. We're here to support you. How fortunate it is for me. But you know what? I do that now for people that I work with. Because I see a lot of people that are in that, I'm not sure if I should even volunteer. My anxiety. I just know I'm going to be anxious if I volunteer. And I do say to the people that I work with, don't live out your diagnoses. I'm sorry if that sounds a little harsh, but what I'm trying to get them to understand is don't remind yourself every day that you have anxiety. Don't remind yourself every day that you have depression or schizophrenia or that you're bipolar. Just say, okay, that's a part of me. I'm in recovery, so I'm going to try and go and really be strong again and do some things. That's what I'm telling them. Don't live out that diagnosis every day and be reminded, because that will slow you down, and it will bring people to a point where they don't leave their home, they don't do much of anything. They do come to Shiraka because it's a great social place. And they always say, oh, I have great social skills. I love to be social. I come to Shiraka. And they see all their friends there. And I say to them, that's awesome. But you know all these people. This is your comfort circle right here. Because you're all mentally ill and you're all sharing your medication stories and and I love it that they do that. They are social there. But I'm challenging them and saying, what can you do in the community? Maybe there's something in the community, another group you can join. Maybe community education group you can join. Many different things to find even more of a social life. Right now I'm teaching a class. It's called The Journey of Renewal and Revival. I'm a little tired of the word recovery, although I know it's still really, really important. But recovery is everywhere. Recovery is that word, and it's an important word, and it's a positive word. But I came up with renewal and revival because I'm working with a class of people who they have their apartment, they have their place to live, they have their bus pass, a couple of them have part-time jobs, they have their friends at Shiraka, so they're in recovery, definitely. So the question is, what else do you want? Is there more? And so in the class, we end in 2 weeks, but about 2 weeks ago, I challenged them, does anybody want to invite the class into your apartment and host the class, send out an invitation, get a few snacks, tidy up your place for company and have the class come in to where you are and where you live. Sort of a challenge for the social skills, bringing people in instead of always just shutting the door and going somewhere else. And I had 4 people out of 6 that volunteered, and so now we are meeting in their homes, and we have had more fun, really. I just find it's like they're more open and they're engaging. And at Shiraka, we're sitting in a conference room, in a chair, at a table with the whiteboard, you know, and in their homes, it's just been a pleasure. So to me, that is like the kind of things that I am interested in working with people and really challenging them. Look for that renewal, look for that revival. You're doing fine. You know, I know you have depression, but let's not talk about it every day and really move on. And that's why I'm here today to talk to you, because I think that's what I've done in my 25 years. It wasn't always easy. No, I'm not saying that. I still have times where, you know, I'm just like, oh, really? But I do have more days and more fun being, well, I'm a mother and a grandma. I have 6 grandchildren, and they range in age from 19. My oldest grandson just finished his first year at Mankato, and we have a little baby girl at the very, very end of the chain that's 2 months old. So we've got a range and anywhere in between. It's awesome. And we are bleacher creatures. I'm married again, by the way. I did get married after I was in recovery, and so my husband and I, we're bleacher creatures because our grandchildren are in softball and baseball and soccer, and oh, it's just awesome. It's a wonderful life. If you've never tried it, I hope you do when you have grandchildren, because it's a real reward. So again, I just want to emphasize things now. That's enough about me, but I wanted it to be positive because the illness was traumatic. The illness was, if I can say, going to hell and back, okay? But the positive is what I want to share more with people, because then you have the hope for anyone that you know or that you may work with or that you may talk to about mental illness. You know, there is hope. There really, really is hope out there. And for NAMI, I started out actually as a NAMI Connections facilitator. NAMI Connections is a peer-to-peer support group for people with mental illness. And they feel very comfortable coming, and they share and they support each other. And when they become regulars, if they come back often, they just feel like they can really help each other because they know. And a lot of times some people just come once or twice and then they don't come back again, and that's okay. But the NAMI Connections has been, and it's been great for me too, because I still have a lot to learn about mental illness. Just because it's in me doesn't make me an expert, okay? I still have a lot to learn, and so I still learn in NAMI Connections. And that, to me, they're all over the city, they're all over the state. You can go on NAMIhelps.org, and it'll tell you where every NAMI Connections class is being held. And I've participated in Day on the Hill. If Sue were here, she'd have a legislative report for us, and maybe Kay has a little bit of that, I don't know. But there is a lot of work done by Sue Abderholden and other staff at the Capitol and in all those buildings on the Hill to help fund mental health, because that is a very, very significant thing. I also have been to the NAMI conference. They host a conference in the fall. I've been on the NAMI walks in the fall. If you haven't been there, it's not just for people with mental illness, it's for the community to support. You know what we did this year in May? May is Mental Health Awareness Month, and our color is green, in case you guys didn't know that. We made green ribbons, the same kind like the pink ribbons that are pretty common and that people see everywhere, and we made green ribbons. We gave them away at the conference. We went to another conference this spring, and the CSN, and we have green ribbons to say, you know, be aware. We have a recovery event at Shiraka. And anyway, we gave out green ribbons, and I told everybody, let's make it okay to talk about mental illness. If you've seen the ads on TV, it's hard for people. They don't know what to say. I get that. I know what to say. I practice a lot. I love to tell people when I've met with a new group or I'm with people at church and, oh, Maureen, what do you do? That's the first question, right? Where do you work kind of question. And I say, oh, well, I work in mental health. I work at a facility in Bloomington with people with mental illness. And 9 times out of 10, I'll get, oh, really? Oh, that should be interesting. Kind of those little snarky kind of remarks, you know. Or, really? Oh, is that difficult to do? And so my answer to them is, well, no, it's not difficult at all, actually, because I'm mentally ill. And so I fit right in. I have a mental illness, and I support these people. And then they don't know what to say. Then they're kind of like, oh, well, that's really nice that you do that. But once in a while, somebody will say, you know, my brother struggles with mental illness. And people, once they know it's okay, we want to make it okay to talk about mental illness. And once that little door is open with that crack to say, okay, I'm talking about mental illness now, other people will, and they will start to share. And so I do appreciate that. I am part of the NAMI Speakers Bureau, which I think that's probably my favorite one. Would you ever guess? Because I like to talk. And so the NAMI Speakers Bureau and I get to go out to different places and do presentations. But probably my favorite, I've been asked to speak for the family-to-family classes. And if my mom and dad, and my mom, God bless her soul, she died 2 years after I got out of the hospital from a very rare bone marrow disease. So my guardian angel, my cheerleader, was gone. And I survived that. My family was really worried, obviously. But I thank her every day for everything she did. And now I go to these family groups because I think if my family had had some education like that, 12-week class, these parents come in and they're saying, please help me understand. They say to the instructors, I need help in understanding. I have a son, I have a daughter, I have a spouse, I have a parent, whatever it is, they want to understand family mental illness and be able to support. And so I go in there and I give this little half-hour talk, my story, but mostly concentrating about family and family issues. And then I get this wonderful thank you from the entire class. It's a card, you know, one of those big cards about that big, and everybody wrote in it. And so many of them say, it's like we can feel hope again. Once they heard and saw me and know what people with mental illness can accomplish, and they go, you know, we really know that we can have hope. And so that is really, it's just very touching to me, and it's very important to me to help these family members because my family survived. In fact, my daughter, she survived. I don't know how. She lived with Grandpa and Grandma, and then my brother, and then her girlfriend, and she was just spread out all over Eden Prairie while I was in the hospital. But now she joins me, and we do a presentation, a 1-hour PowerPoint for conferences and mental health agencies about mental illness in the family. And she tells it from her perspective. And she doesn't miss anything. She gives the whole story. But that's what people need to hear. And so I do really enjoy that family to family. So that's my story. I'm sticking to it. Anybody have any questions? Or maybe we'll wait till the end, right?
Well, no, you can ask.
Any questions, or should we wait till the end? That's fine. Thank you. Back to you.
Yeah. And Maureen has another appointment for work, but she'll be here for part of the presentation still. So if you do have a question, just ask. You don't have to wait till the end. Well, I'm going to tell you a little family story because I'm a family member, and then I'm going to start talking about resources. So please ask questions. But I was born to a mother that already lived with mental illness. And my mom graduated from North High School in Minneapolis, and she was, one of 4 siblings. And she was the youngest for a long time, and then her brother was born about 7 years later. And I always bring my family pictures because I figure I'm getting to be the oldest in my family, and I have them in shoe boxes. So I mean, like, what are you supposed to do with those pictures? So in this fancy frame that I'm going to pass around is a picture of my mom with her 2 older sisters. And my mom's the youngest in this picture, and she looks like a little boy in a dress. And my mom was born in 1920. So my mom went to college at the University of Minnesota, the Twin Cities campus, and when she was a freshman, she had a psychotic break. And you heard Maureen say that she also had a psychotic break when she was 40. So what's a psychotic break? I mean, just what's a layperson's description of a psychotic break? That's it. Break from reality. That's all it means. For some people, that's hallucinations. Could be an auditory hallucination, voices. Could be a visual hallucination. Could be actually a delusion. Do you know what a delusion is? False belief. You know, if someone thought that their coffee was poisoned, you know, and it isn't poisoned, that would be a false belief. That would be a delusion. If someone thought that the FBI had put a transmitter in their brain, that would be a delusion. You know, implanted it to be able to read their thoughts. That would be a delusion. False belief. So you can have a psychotic break, which my mom had, and she then was hospitalized at Fairview Riverside. And she got better after a time, went back to college. Second year of college, sophomore, she had another psychotic break. And so this time my mom was really discouraged. She knew something was not optimally working in her brain. She thought I must not be cut out for college, and so my mom dropped out of college and went to work. And it was war years by that time. So I'm going to pass this picture around because in this picture, the oldest child in the picture, my Aunt Florence, she just died 4 years ago at 94, and she did not live with a mental illness. She was a head dietitian at St. Mary's Hospital in Rochester. My mom did not finish college, but my mom owned a restaurant with my dad in LeSueur, Minnesota after they got married. She raised 2 kids. She was a librarian in LeSueur for a while. So my mom lived a long life. She was 82 years old when she died. She didn't die of bipolar disorder, which is what she lived with. My Aunt Bernice, the middle child in this picture, she 4-year degree from the University of Minnesota, RN, married a doctor, had 8 kids, lived in Crookston, lived with severe bipolar disorder. She lived a life also. And she died in her 80s, 82 also, of a stroke. So, you know, people live lives and manage their illnesses. That's kind of the message I think that both Maureen and I want to be sure you know today. You know, it doesn't mean it isn't hard. When you tell a short story in 5 minutes or 10 minutes, it sounds really like things are really great. In actuality, there's lots of ups and downs, but just know that family members do okay, and people who live with illnesses do more than okay. So I'm going to pass this picture around, and my Uncle Christian wasn't born yet in that picture, but my Uncle Christian died in his 40s by suicide, by gunshot. So in those 4 kids, 3 of the 4 lived with a mental illness. Now, I have just 1 sibling, so my mom and dad got married after World War II. My dad had graduated from Gustavus in St. Peter, Minnesota. And he and my mom got married and they moved to LeSueur, which is between Mankato and Minneapolis. That's where I was raised. Here's my mom and dad's wedding picture. And my mom and dad, my mom looks a whole lot better. She doesn't look like a little boy in a suit anymore. But my mom and dad's wedding picture, it was war years, so they're dressed in good-looking suits, not in the big white dress and things like that. And then they had 2 children. My sister's 8 years older than I am. And my sister lives with bipolar disorder also. She was diagnosed at 15. So you can see my mom was 18. You know, my sister was 15. These are young person's illnesses usually. And so consequently, my sister lives in adult foster care now. She's in Mankato in a 4-person group home. She has really severe bipolar disorder. So you probably know this, but illnesses, all illnesses are on continuums. You know, mild diabetes, moderate diabetes, really severe diabetes. Mild heart disease, moderate heart disease, really severe heart disease. And so in the case of my sister, really severe bipolar disorder, not mild, not moderate, really severe. So my sister manages a life. She's in her 60s now. And, you know, she struggles with some other health issues because people who live with really severe mental illnesses, their average life expectancy is 25 years less than the general population. So our life expectancy in the U.S. now is about 78, almost 79. That's an average. And so my sister's in her 60s and is probably in the last decade of her life. She's had a heart attack, she's had a stroke, she lives with diabetes, she's had 3 concussions, she has Parkinson's-like symptoms, and they're a direct result of taking medication and living with bipolar disorder. So there's some downsides to these illnesses too. You know, the illnesses, I think we always think, well, it's all about medication. Medication is very important. My sister probably wouldn't be alive today without having taken medication because she had such impulsive behavior that put her at great risk when she was younger. However, these same medications have caused her to have a heart attack, a stroke, and she's had her large intestine removed, not because of cancer, but because her digestive system doesn't work optimally anymore. These are really serious drugs that you take for mental illness. So there's always a yin and a yang to things like that. So, I'm telling you a little more sobering story, but that's part of the story too. However, my sister has had a life. If you met my sister, I think you would find a really courageous, brave person who after 50 years still gets up every morning, still goes about her job, has 2 children. She also lives a life. It's just not maybe the life that she thought she was going to live. Now, people aren't lazy. People should not just snap out of it. It's a disorder of the brain. It's not a disorder of the pancreas. It's not a disorder of the kidneys. It's a disorder of the brain. And I always laugh because my last biology was in the late 70s. But I do know that the brain controls our breathing. Our brain controls our heartbeat. Our brain controls our thinking, our feeling, our emotions, everything. So why is it that we're so derogatory about mental illness? We say things like snap out of it. Would you say something like that to someone with breast cancer? Hey, snap out of it, get back to work. Would you say, you didn't pray enough? Would you say things like, why don't you just get back to work? Why are you living in the basement of your parents' home and you're 35 years old? Now, if someone in their family had someone with Down syndrome in their family, that's not a mental illness, that's a developmental disability. Would we tell that family to get their 35-year-old child out of there? Why aren't they working? Why aren't they out of your house? We would never say that if there was a developmental disability and a 35-year-old was living in the basement. So I think we have to kind of get our head around this a little bit because there's so much stigma. The walk that Maureen talked about, I put a little pink slip. This doesn't mean you're losing your job, this pink slip, but so on this pink slip, I put the NAMI walk down because there's so much stigma. And what's nice about the walk is you are walking with 4,000 other people and you're talking about something that's so hidden. Everybody thinks they're all by themselves, that they're the only family in Le Sueur, Minnesota that has mental illness in their family. They think they're the only person that's struggling with postpartum depression. They think they're the only person that has SAD disorder in the winter in Minnesota. We all think we're the only one who has anxiety disorder. In actuality, I told you 1 in 4 adults live with a mental illness. That means we all know somebody at our church, at our mosque, at our temple. We all know somebody from high school. We all know somebody, from college. We all have a neighbor. We all do. And some of us have immediate family members like me. So, my sister is fine that I talk about it, but my mom was not. My mom died about 14 years ago, and I have to say that really I didn't start speaking about my mom until she was gone because that was her wish. It's her story. But you know what? It sort of is my story too. Families very much get affected by chronic illnesses. I bet some of you have some other chronic illnesses in your family, but it affects a whole family, when someone's ill in the family, whether that be a brain disorder or that be, ALS or Parkinson's disease or whatever the illness is. So I'm going to show you a picture of my mom and sister, and in this picture, my sister's about 50 in this picture, and my mom is about 78. So here's a picture of them. And this was at my niece's high school graduation. So, people live a life. And you probably wonder, where's my dad fit in all this? Well, my dad lived with substance use disorder. Could he work? Sure. Did he provide for our family? Absolutely. But did my dad live with alcoholism? Absolutely. So in my whole family, everybody was ill with a mental illness. So I stand before you lucky. I'm lucky. In my family, there's really quite a large genetic component. Now, we don't know what causes mental illness. Does that sort of shock you? We don't know what causes mental illness. Genetics might play a role. My family, obviously, it plays a role. About 50% of my family lives with mental illness. But if you took biology, even if it was in the late 70s like me, if it was identical twins share the same genetic material. So if one person in identical twins lived with a mental illness, that would mean, if it was purely genetic, that both identical twins would live with a mental illness. We have plenty of research that says that's not true. Eventually, we'll probably find out that it's multifactorial. Many reasons cause mental illness, not just one thing. Genetics just is part of it. Other things are trauma. We think that people are born with a predisposition. Right now, we think people are born with a predisposition. Something puts it in motion. That could be trauma, like people that have come from Somalia and people that were in Laos during the Vietnam War. Trauma could be car accidents. Trauma could be sexual violence, rape, domestic abuse, being raised and being abused as a child in a home. Those could be things like trauma. Being in a war, being in Afghanistan, being in Iraq, being in Vietnam, being in World War II, all of those things could be trauma. You could have been in a horrific fire. You could have been in the Twin Towers at 9/11. All those things could be trauma. So that's a theory. Environmental things, poverty. Wouldn't you agree? I think some of you work with folks that are struggling with poverty. If you, in the recession, lost your job, chances are you may have lost your apartment for rent, and you also may have lost your mortgage or your house. And then you also don't have any place to live, so you're going from couch to couch. Or if you use a shelter, you have to be in a lottery. You don't automatically get a space on the floor at St. Stephen's just because you show up that night, so you may not have had a place to sleep. So poverty might be a trigger because you already have a predisposition, that's a theory, and then something puts it in motion. So I'm giving you kind of the basics, but mostly I want to teach you to fish today because I could hand out a few fish here and there, but we don't have enough time. So I want to use the remaining time to just talk about resources. What do we have at NAMI? What resources are available out there for you? So ask questions if you would like, but that's a little bit of my family story. Okay, let's start with education. So remember Maureen said that one of her favorite volunteer jobs at NAMI is to speak to family classes. We have a 12-week class. It's been taught for 27 years. It's taught nationwide. It's called Family to Family. So if you have family that lives in Nevada, or you have family that lives in California, they can take the very same class. So NAMI offers it in Minnesota twice a year, and they're 12 weeks. So if you do the math, that's 3 months. And it's 2.5 hours per night per week. So 2.5 hours for 12 weeks, and at the end you'll have about 30 hours of training from a family viewpoint. So now families broadly, Maureen went through some of it, but I've taught the class for 12 years, and I do that in my free time. That's not part of my NAMI job. I like that class so much that I give 50 hours at night to NAMI, for family to family class. And so it's learning communication skills, it's learning a little bit about empathy, because again, with our family, we're not quite as gracious. When my mom, it was so frustrating when my mom didn't seek help. She was ill and she needed help. She wasn't sleeping. She wasn't making it to work. And I'm a little kid calling the police to get to my mom to the hospital. And so, what did I know about mental illness as a 7-year-old? So the family class is just very helpful, teaching you some crisis strategies. It's helpful to teach you a little bit about what are medications, learning some of the yings and yangs because there's side effects of medication. It's learning a little bit about how do you problem solve? If there's issues in the family that need to be solved, we teach a problem solving strategy. So it's just really nuts and bolts. So I have grandparents that take my class. Almost always there's people that are 80 years old taking my class because they have 60-year-old children living with them still. Or they have 60-year-old children that still are struggling with symptoms. So I have 80-year-olds in my class. I have step-parents in my class. I have people like me that are a child, of a parent that lives with mental illness. You're a child till forever, right? I mean, you could be 70 years old and you're still the child of a parent that lived with a mental illness. So it's open to anyone and it's free. Where else can you get 30 hours of really good training for free? So this fall are the next classes. So they start in September. They'll be posted on our website in July. So if you know someone that would benefit from a 12-week family class, tell them about the class. We also have winter classes, and they start sometimes January, sometimes February, and they're statewide. Now, the only reason we don't have more classes, like you'll look at it and say, well, there's not one in my neighborhood. Well, they're taught by volunteers, so you've got to have somebody like me for 12 years of giving you 50 hours a year, But it's a good class. The other class we have is 6 hours. It's called Hope for Recovery, and Hope for Recovery is offered at least once a month in the metro area. It's also taught statewide. And it's 6 hours of the basics of mental illness, and it's free. So again, if you have clients or if you have families that would be interested in learning more about mental illness, it's 6 hours. It's called Hope for Recovery. It's on our website, namihelps.org. So that's a good class too. One of the things that's covered in that class is some communication strategies. And has anybody ever heard of this book, I'm Not Sick, I Don't Need Help? Because sometimes when you live with a mental illness, you actually don't have insight. It just doesn't mean that you are in denial. It just means your brain does not perceive that you're ill. Sometimes it's just hard to step back to see some of your bad habits. Would you agree? It's a little hard. Other people can point them out to you. I have a husband that is particularly good at this. I'm joking. But I'm particularly good at pointing out his things that he needs to improve. But it's hard when you have lack of insight. If your brain doesn't perceive the illness, it's really hard to get help. So the book is kind of catchy title, I'm Not Sick, I Don't Need Help. It does not mean you're in denial. It does not mean that you're obstinate or you don't want to get help. It really is, the brain does not perceive when you're symptomatic. When you're stable, most people can realize that they need some help. So it's a good book. You can get it at the library. You can probably order it from Amazon or places like that. But there's a communication strategy in this book called LEAP, L-E-A-P. And in that Hope for Recovery 6-hour class, they actually take about an hour and a half and use some of the strategies from this book. So I'll pass the book around, but you can get some hands-on kind of hour and a half by actually taking the Hope for Recovery class, or you can just read the book. So I got to be sure I don't trip on any cords. There you go. Just pass it around. Okay. Maureen also mentioned we have a conference. So I put our annual conference on this little pink slip. It's in November. And if you need continuing education credits, because I suppose some of you might be social workers or some of you might be nurses or things like that. But if you need continuing education, it's a pretty reasonable way to get continuing education. So I'm going to tell you, I've probably gone to the conference 12 years. I've only worked for NAMI 6 years, but I volunteered a long time for NAMI. And I'm just going to tell you about a few of the sessions I've gone to because they've been really good. I can't promise you these sessions are ever going to be repeated, but they're good. I went to a session where the head of the psychiatric emergency room for Regions Hospital and the head of the psychiatric emergency room for Fairview Riverside, they were on a panel. And the name of the session was The Day in the Life of the Mental Health Emergency Room. Isn't that interesting? Now, I have been in every mental health emergency room probably in the state with family and friends, and I thought I knew pretty much, everything and how it works and stuff, but I learned a lot because they told me on average 60% of people that come to the emergency room with signs and symptoms are admitted. The other 40% aren't. Now, by the way, they came with symptoms, but they aren't admitted. So I said, well, what exactly happens to the 40%, right? And they said some people get a referral to call a psychiatrist the next day. Some people get a partial hospitalization, where you go to day treatment and you're not hospitalized. Some people are just sent home. And by the way, they could have come being actually suicidal. They could have come to the emergency room because they talked about killing themselves. So their family or the 911 brought them to the emergency room. And by the time they waited in the emergency room 7 hours, which you could, by the way, wait that long, the symptoms passed. So by the time they saw the psychiatrist, they said, well, no, I'm not suicidal at all right now. So they get sent home. So that means family members who didn't even have a health class, right? You told me you didn't have a health class, correct? You're going home with someone who only 8 hours earlier said they wanted to kill themselves. So are you going to stay up all night watching your 30-year-old sleep and hope that they don't kill themselves in their sleep? Is that what you're going to do? Do you think they have a discharge for that person that they turned away at the emergency room? Do you think there was a discharge meeting with you where they kind of went through what you should know and what you shouldn't know? Do you think they did a 4-hour tutorial with you as a family so that you'd know what to do? No. They don't even do that for people that are really ill. So my point is, we have so much more education that we need to do, and actually the professionals are pretty good. Hopefully they at least give them NAMI's website. They send you home and say, well, here's a website if you want to learn more about, classes and things like that about mental illness. But I just want you to know that, it was interesting to hear about a day in the life of the emergency room. The other thing is, I went to a multicultural breakout because, there's differences in mental illness in cultures. A person that is from Laos, that's Hmong, does not see mental illness the same way as an African-American person here in the U.S. A person that's Hispanic from Mexico does not see mental illness the same as someone from Somalia. It is not the same. Now, here's the sad news, and then I've got good news. The sad news is there's not much written about it. There's not much written about cultural differences in mental illness. But I'm going to tell you the good news. Cultures now have lived long enough in Minnesota, meaning people from Somalia, people from Tibet, people from Laos. They've lived here long enough that people have gone to college, and we do now have some social workers that are from other cultures. We do now have psychologists that are from other cultures. We do now have a few psychiatrists that have made it all through med school because they've lived long enough now in the United States to have gone through training. So it's very helpful to have someone who's culturally appropriate doing the mental health education as well as the mental health treatment. So that's good news. The other good news is I've got, for those of you who want to get a master's degree or a doctorate, I have your thesis. This is the other good news. Those of you that have aspirations for higher education, I can give you cultural differences in mental illness can be your thesis. I'm serious. I've got your thesis right for you right now. So that's my good news. Now, this is a sorry fill-in, but I'm going to show you a book that some of you probably read if you took a sociology class. But this book is called The Spirit Catches You and You Fall Down. It's nonfiction. It was written more than 15 years ago, but it is still helpful because it's about epilepsy. Now, epilepsy is not a mental illness. Epilepsy is a disorder of the brain. Bye, Maureen. Thank you. Keep the world safe for mental illness. Okay. Yeah? Thanks, Maureen. So The Spirit Catches You and Falls Down is about a little girl that was born to a family in California that was Hmong. And she was born with epilepsy, and she had grand mal seizures. And I don't know a lot about epilepsy, but grand mal seizures are serious, and she had them right away when she was born. And they also cause brain damage when they're not treated, so they're serious. So her family was thrilled when she was born. This is a loving family, very large extended family. They were thrilled when this baby was born, and they also thought that she was a gift from God. The God of the Hmong culture. They thought she was a gift from God, and they thought she was a shaman, which was very positive. So the family thought the epilepsy seizures were good. Now, the pediatricians, of course, knew that the grand mal seizures would cause brain damage. So Western medicine and the Hmong family, didn't see it the same way. And it wasn't just a language issue. They had translators that were trying to explain and things like that. It wasn't just a language issue, it's a cultural difference. So I think the book is particularly good because it tells how Western medicine and other cultures just don't always see things the same way. And so as a result of the book, you just realize how frustrating it was. Eventually the little girl was taken out of the home by child protection. This was a loving family that only wanted the best for their daughter, and child protection only wanted the best for the child, and the pediatricians only wanted the best for the child, but they were getting nowhere. Now, Ann Fadiman, who wrote it, is a journalist, and I actually got to hear her speak 5 years ago at Kaufman Union. She was a speaker for a campus event, and she told a little bit about the family. She gave kind of a follow-up to this, because this happened quite a long time ago. So I'm not going to tell you any more about the story, but I highly recommend it, and you can see I bought it at Half Price Books. Every time I find it, I buy it, because I hand it out to people. I say, you should really read this book. My book club has read it twice. I've been in the book club 20 years, and every 10 years I make the group read it. It's a good book, so I'll pass this around. I'm coming to the back to give it to you so that you don't feel left out. Look at this is going to be my close-up. All right, thank you. Okay, so there are cultural differences, obviously. So go to the conference. You can go to at least 4 breakouts. There's also keynote speakers, and it's reasonable. It's usually under $100, and that includes lunch and breakouts. So if you need some continuing education, it's pretty good. Okay, other things. We have booklets, and so I'm just going to point out a few of them. But if you go to our website, NAMIHelps.org, all of our booklets can be read on the website, because we don't have enough money to give everybody booklets on everything, but you can read them. So let me just give you a couple examples. This book is called Understanding Psychosis. Now, psychosis is not a mental illness. Psychosis is a symptom. So let's say you have a break from reality. You can have a break from reality with substance abuse. You could use marijuana and have a break from reality. You can have dementia, which is not a mental illness, but it's a disorder of the brain. You can have dementia and have a break from reality. Lewy body dementia, which is a type of dementia, often has visual hallucinations. So that's an example of psychosis, not a mental illness, because dementia is not a mental illness, it's just a disorder of the brain. You can have psychosis with schizophrenia. You can have psychosis even with depression. It's not real common, but you can have it with major depression. Yes?
I was so surprised that at one time I had a speaker come to my class at school, and she worked in a geriatric psych unit at the hospital, and she told me that sometimes seniors, older elders in the community who end up having psychotic symptoms, it's caused by a UTI.
Yep.
Urinary tract infection. I was like, what?
Yep.
And so they just treat the UTI and the psychosis goes away.
So your colleague just said that she took a class, and one of the speakers said that you could have a break from reality, or you could have signs and symptoms actually of depression too, because you have a UTI, which is a urinary tract infection. That is true. I work with older adults, and it's very true. So it's important to get into the doctor, because you may not have a mental illness at all. You might have a lab test and find out you have a urinary tract infection. So it's very important to get into a doctor because some of the signs and symptoms of mental illness can be a brain tumor. Brain tumor is not a mental illness, but it is a disorder of the brain. You could also have a traumatic head injury. Traumatic head injury is not a mental illness, but if the injury is at a part of the brain that controls your thinking or your feeling, it could look like a mental illness, couldn't it? So it's really important to get into the doctor because you know what? If I had memory loss and confusion, which by the way are some signs and symptoms of depression, memory loss and confusion can be a sign or a symptom. And let's say I ran into the doctor. I don't think most people run into the doctor for that, but you know, you run into the doctor, and let's say the doctor did a battery of tests. Many doctors have been trained to be able to diagnose for Alzheimer's. By the way, a trained professional can diagnose within 90% accuracy. You have to wait till you have an autopsy of your brain. 90% accuracy, that's really good accuracy. And so you find out that you don't have Alzheimer's. So I have memory loss and confusion. I go in, the doctor says, "Kay, you don't have Alzheimer's, you have major depression." I'd be like, "Yeah, woo!" And why would I be excited about that? It's treatable. You know that Alzheimer's is fatal. So who wants to hear you have Alzheimer's? But I could have major depression, and 80% success rate of treatment for older adults with depression. It's even better for younger adults. 80%, that's really good odds. So if I had memory loss and confusion and that appeared to be major depression, that's treatable. Alzheimer's is not. Now that doesn't mean you don't want to get help for your Alzheimer's. You want to plan your life, you want to get your affairs in order, you want to spend your time with your family and other loved ones. You know, it doesn't mean you don't want to get diagnosed, but I'm not quite as sure I'd run in quite as fast. But if I thought that it might be depression, I'd be in there, you know, getting an evaluation as fast as I could. So, but here's one book. Another book is Hope for Recovery. This is a good one. This is about the adult mental health system in Minnesota. Because, you know, unless you have a really good class that you take, what do you know about the mental health system in Minnesota? For starters, it's different in other states. So let's say you came from another state or another country. In Minnesota, our mental health services are through the county. In some states, the mental health services are through the state. So, I mean, first of all, how do you navigate the system? Do you all know what an ACT team is? Do you all know what an arms worker is? Do you all know? I mean, some of you do. But, you know, unless you know what those things are, what 45-year-old mother in Eden Prairie knows what an ACT team is, unless somebody in their family has had, you know, a severe mental illness. So this booklet has the basics, you know, about the mental health system in Minnesota. It's called Hope for Recovery. It's on our website. We also have a whole set of booklets for kids because, again, 1 in 10 youth live with a mental illness. We try not to diagnose till they're older, but we still treat signs and symptoms. So if kids are having challenging behaviors in school, we still want to get help for them. We just try not to label them with a diagnosis until they're a little bit older because the brain is not fully formed until, you told me, 25, 26. So, you know, we have a booklet on psychiatric hospitalization for kids. Do you know that in Minnesota, I just spoke with a parent probably 2 months ago, and her 6-year-old had challenging behaviors and talked about killing himself, 6 years old, and they took him to St. Mary's Hospital in Rochester. They lived in a little town by Winona, and they took him to Rochester. And, you know, Rochester's part of the Mayo Clinic. St. Mary's is where they took him. And they had to hospitalize him, and the closest bed was Duluth. So that means a 6-year-old went to Duluth. The mom and dad don't live in Duluth. There's no Ronald McDonald House for them. So does that mean that they take off of work so they can be with their 6-year-old for 3 weeks in the hospital up in Duluth? Can you imagine? I mean, can you imagine? And so you don't leave your 6-year-old in a hospital room by themselves for, you know, for 3 weeks. But that's where the closest bed was available for children's mental health. We don't have unlimited help for kids. We don't have unlimited help for adults. You know, 1 in 4 adults live with the illness, but the funding is not there. You know that from some of the work you do. Yes, it is. Minnesota is. Isn't that scary? Yeah, even though we're quite good as a state, you know, there are states that don't do as much as we do, and we don't have enough. So this booklet's on psychiatric hospitalization for children. We have juvenile justice system and mental health. Lots of people end up in the criminal justice system, kids as well as adults, where they really belong in treatment. They don't belong in jail. You know, once you get a record, let's say you take a swing at a police officer, you're 19 years old, and voices tell you that that's not a police officer. You know, that really is someone who's going to harm you. They're not a police officer. So you take a swing at them, that's a felony. So then you could be 19 years old with a felony. Now, what 2 things get affected by having a felony or anything on your record? Housing, because they do background checks, and jobs. So you could set your whole life course at age 19 because you have a mental illness, and it'll be hard to find housing, and it'll be hard to get a job for the rest of your life. I'm not saying you can't. Obviously, people get jobs with felonies and things, but it's hard. So, we have books on the juvenile justice system. We have books on the adult criminal justice system. So take advantage of those. Another set of books I want you to know about is that, has anyone heard of the National Institute of Mental Health, NIMH? Maybe you've heard when you've read a research study or something, it might say National Institute of Mental Health. It's a government agency. It's based in Washington, D.C., and they have information on all the illnesses. So if you want to read, like let's say someone you work with as a client lives with, they tell you they live with borderline personality disorder. Well, you may not know anything about borderline personality disorder, so you might want to read about it. So they have booklets on all of the illnesses, and you can read them online. So when you go to the NIMH website, National Institute of Mental Health, they have a publications section. You can read all of their booklets online. And also they actually are PDFs, so you can print them out. Because the government doesn't have any money either. You don't have any money, we don't have any money, and the government doesn't have any money.
Can you purchase those nice looking books?
You can, just at cost. So I have an order form, so if you see me at the end, I can give you an order form if you like. They're just at the printing cost.
Yeah, I can go to your
Yeah, that'd be great. So I'm going to pass these around, but I have a sample of post-traumatic stress disorder, I have a sample of schizophrenia, and I have a sample of bipolar disorder. But, borderline personality disorder, they also have a book on that, and that's a disorder that a lot of people don't know very much about. So I highly recommend reading a little bit about illnesses if you have someone in your family that's been diagnosed or a client that you work with. Do you mind kind of spreading these out a little bit? Okay. So those are some resources for you. Now I'm going to tell you about two classes that I teach, but they're taught internationally. They're taught in every state in the United States, and they're taught internationally. One is called Mental Health First Aid. Has anybody taken it? It's 8 hours. So you'd know you'd taken it. Okay, it's 8 hours. Now, I'm not trying to put you on the spot, but did you find it helpful? It is pretty helpful. It's like taking CPR or taking American Red Cross First Aid, only this is for mental health. So it's 8 hours. It's a commitment. It's a full day. But it typically is about $80. And NAMI has some grant money right now from DHS. So periodically we'll have a class on our website that you can just sign up as one person. Or let's say WellShare wanted to have a class just for employees of WellShare. For $1,500, which is pretty cheap for 25 people, 8 hours, $18 book. It's pretty cheap. I don't know if I can do the math, but it's cheap. So $1,500, 25 people, 25 books. It does cost you the time of your employees taking the class. But you can take this class. So you could have a class just for your workplace. You could share the class with another nonprofit. Like you could say, we'll take half the class, and then PPL, Project Pride for Living, maybe half their employees could take the other half. So you split the $1,500 with another agency. I've had churches have it, so they've had all their volunteers take it, or they've had their pastoral staff take it. I've had colleges take it, because guess what? Don't you think college staff should know a little bit about mental illness? Because what age group is this? It's college age, it's high school age. We have teachers that take it, but let me just tell you that Adult Mental Health First Aid, I'll pass the book around so you can look at it. This is the student book. So this is the book you would get if you were in the class. And I've taught it for 6 years. I think it's a good class. Pretty basic, but it does teach you about suicide. It does teach you about communication. It does give you resources. If you have someone that you love or a neighbor or something that is struggling, it can give you some suggestions of how to talk to them, how to maybe give them a resource if they need it. So there's that.